Antisocial personality disorder, or APD, is a psychiatric condition in which a person manipulates, exploits, or violates the rights of others. The severity of symptoms of antisocial personality disorder can vary. The more egregious, harmful, or dangerous behavior patterns are referred to as sociopathic or psychopathic. A sociopath have relatively normal temperaments, their personality disorder being more an effect of negative sociological factors like parental neglect, delinquent peers, poverty, and extremely low or extremely high intelligence. While psychopaths are born with temperamental differences, such as impulsivity, cortical underarousal, and fearlessness, that lead them to risk-seeking behavior, and an inability to internalize social norms. Here's a comparison chart between a sociopath and a psychopath. Some symptoms of antisocial personality disorder are failure to conform to social norms, such as disregard for society's laws, violation of the physical or emotional rights of others, being irresponsible, or the lack of stability in job and home life, lack of remorse, superficial wit and charm, recklessness, and impulsivity. Antisocial personality disorder is a mental condition affecting 1% of women and 3% of men in the United States. Like most personality disorders, antisocial personality disorder typically will decrease in intensity with age, with many people experiencing a few of the most extreme symptoms by the time they are in their 40s or 50s. Treatment and diagnosis: personality disorders, such as antisocial personality disorder, are typically diagnosed by a trained mental health professional, such as a psychologist or psychiatrist. A diagnosis for antisocial personality disorder is made by a mental health professional, comparing your symptoms and life history. Many people with antisocial personality disorder don't seek out treatment. People with personality disorders, in general, do not often seek out treatment until the disorder starts to significantly interfere or otherwise impact a person's life. Antisocial personality disorder is one of the most difficult personality disorders to treat. Individuals that has APD rarely seek treatment on their own, and may only initiate therapy when mandated by a court. There is no known effective treatment for this disorder. Some possible causes of antisocial personality disorder are: genetics factors. Is suspected that antisocial personality disorder is higher in people with an antisocial biological parent. Abnormalities in development of the nervous system. Environmental factors such as bullying, abuse, and neglect are believed to contribute to the development of antisocial personality disorder, since a person whose role model had antisocial tendencies is more likely to develop the disorder. Prefrontal cortex. This area of the brain is thought to be responsible for behavior including appropriate social behavior, judgment, and impulse control. Antisocial personality disorder is thought to develop from chemical imbalances in specific areas of the brain. Famous people with antisocial personality disorder: Theodore Bundy, or Ted, was a serial killer who prowled in Washington, Utah, Colorado, Idaho, and Florida, killing around 35 women in the 1970s. Bundy also exhibited many symptoms of ASPD, including charm, aggressiveness, and impulsivity. He was classified as high factor 1 psychopath, which means he is very intelligent and had few indications of psychopathy early in life. The components of a factor 1 psychopath include a grandiose sense of self, pathological lying, conning, manipulative behaviors, lack of remorse, lack of empathy, and failure to accept responsibility. Jeffrey Dahmer is a notorious cannibalistic serial killer who killed 17 men in the Milwaukee area in the 1980s and 1990s. Dahmer exhibited many different aspects of ASPD, including lack of empathy, deceitfulness, and lack of regard for the rights of others, along with paraphilia, necrophilia, partialism, and other features. Dahmer was also diagnosed as suffering from alcoholism, a personality disorder, and an antisocial personality disorder with obsessive-compulsive and sadistic components. He was also diagnosed as having a sexual disorder.